Hi everyone. As the rest of the staff is down doing birthday parties, our veterinary staff is in here prepping for surgery. You guys might recognize the beautiful little girl here, Josie. Josie's our domestic cat that came to us after she had head trauma, which left her with cataracts and some facial structure issues. She has had chronic eye issues on that left eye. She's had to have cones. We've tried putting soft paws so she doesn't scratch it. She's been She's been to the eye doctor. She's been for an MRI. Dr. Campbell, Dr. Camper have treated her a lot. And so the decision, and we can talk to Dr. Campbell a bit, has been to remove her eye today. And that might seem extreme, but actually it's not. It's really in her best benefit because she has such extreme cataract. She really isn't using that eye, can't use that eye. She really hates the medications. She's really making that eye red, raw, and painful. She hates her cone. And so this is the best thing to give her lifelong comfort. Tell us a little bit about the procedure today.
Well, you mentioned that we did some advanced imaging and things. We really didn't find anything on that. We've also had her at an ophthalmologist as well to look at the eye specifically and see if there were some things that we could do to help her that way. Unfortunately, there just really wasn't any good options for her. And like you said, she continues to just do damage and have chronic infections and discharge and things from that eye. So she also has mature cataracts in both eyes, so she's not visual too much anyway. She can probably see light and shadow, but doesn't have the ability to focus and good recognition that way. So what we're going to do, under anesthesia, she'll be intubated. We'll do blood work and get her all hooked up to the machines, and then basically what we do is we cut around the eye, get all of the tissue that's associated with the eye, the tear production, glands, all that sort of stuff comes all out at once. And then we tie off the blood supply to the back of the eye, including the optic nerve, and then close up the eye with sutures just like you would a regular incision site.
Awesome. And we've done this with other cats here, and honestly, within 24 to 48 hours, they're acting so much more comfortable than they did prior to the surgery with that irritation. Her recovery, you said she'll be in the hospital here for just a few days for observation and probably have her cone again just to make sure she doesn't hurt the site. But then when do you expect her to be back upstairs with her buddy Edgar?
Probably 3 days.
3 days, awesome.
That would be the hope. If she has any trouble getting around, it would be the biggest issue for her. Then we might bring her back down here. But she'll be fine after about 3 days of pain medication and that sort of thing.
Well, awesome. They just poked her, so they're going to be prepping her for surgery. If you're just joining us, this is, I'm going to try and be quiet too because she just poked. I don't want to stimulate her so she can go to sleep. Little Josie, the domestic cat, is going to have her left eye removed today. This best course of action based on everything that has been done and tried, and we just want her comfortable and is back to her happy, fun-loving self without having to irritate and scratch and have a painful eye. As we talked about, she doesn't have vision in that eye. She's advanced cataracts, and her, it'll be about 3 days before she's back upstairs with everybody, so not a long recovery at all. The surgery takes about an hour, so we'll update all of our sponsor parents. And as you guys know, we don't take these decisions lightly. We do what's best for the animal, and it's at whatever cost. We've done everything from the eye doctor to the MRI, which was extremely expensive, to now eye surgeries. Eye surgeries can be $1,000 to $1,200, but it's not about the money. It's about making sure this young girl has comfort for the remainder of her years. And she's going to be just as beautiful and special with one eye that doesn't work than two eyes that doesn't work. And so far, the other eye, how's the other eye been doing from an infection or anything standpoint?
It's actually been really calm. It does have some issues. It has a mature cataract, but we're not seeing any of the problems that we're seeing the surrounding area, the infections,
Anything like that,
and
so.
that sort of thing. So that one looks like it's in pretty good shape, all things considered.
And how much do you think she can see out of that eye? About the same?
Yeah, probably
Just
about the same,
shadows.
just light and shadows. Yeah.
So, okay. Well, awesome, everyone. We're going to let them do their work and to be sterile environment. And because it is a specialized surgery, we won't be videoing the surgery, but we will be doing updates and give you kind of an update tomorrow. Maybe we can visit her and things like that. And the rescue group that actually placed her with us is going to be visiting tomorrow for unrelated visit, but they'll get to see this wonderful girl too. So thank you so much, not only celebrating the birthdays and the toy drive today, but always supporting us so we can always do that preventative medical care and surgery for cats like Josie.